Hello and welcome to the Monday, April 13th edition of the Daily Situation Report. My name is Tracie Smith and I am here with Incident Manager for our hospital's COVID-19 response, Dr. Stewart Kennedy. Dr. Kennedy, there were 7 new confirmed cases announced in our community yesterday. Is our community doing enough?
Well, Tracie, it's still not unexpected. We know there is some community spread out there. At this point in time, we believe it's minimal, but I think we may not be doing enough. We really we have an opportunity to stem the tide on this COVID-19, but only if we all are doing the right things and we all take that responsibility very seriously. Just as an example, I was out for a driving home from the hospital yesterday afternoon, and for the most part, individuals are being very respectful, keeping their distance. But I still see a number of people congregating on their walks. The nice weather brings people out, not keeping their 2-meter distance. In fact, at one point I saw about 8 of them congregating at a corner of the street just talking. We cannot let our guard down. This is what is going to get us in trouble if the nice weather comes and people are not following the rules. And please, if they're not following the rules, I want other people, other citizens, in a polite and kind way to call them on it. We can't do it all, and we need your help. The reason for this message is we must keep this disease from coming into the hospital, coming into long-term care facilities, and if it's in the community, anybody can spread it. So we need to be really cognizant of the ability to take your own personal responsibility for each other, because we still can do more. I think on the whole, we're all doing a great job, but there's still breakage in protocols that we need to call people upon.
Really need to stop the spread. The physical distancing is one of the most important things that people can be doing right now.
Absolutely.
Okay. So with the new confirmed cases in the community, are there any new cases here in our hospital?
And we're doing great that way. We still have the 2 confirmed cases in our hospital, which we've had since Friday. We did discharge 1 home last week in an improved condition. So certainly we're in good sort of steady shape that way. We do have 28 presumptive cases, meaning we've done the swabs, they met the criteria. We're waiting for the results to come back, but certainly on the vast majority they come back negative too, but we still got to treat them as COVID-19. So we're in good sort of position right now at the hospital, but I can't really sort of emphasize the need to actually keep the awareness and the vigilance that we require, because we do not want COVID-19 coming to this hospital unless they need good medical care.
Okay. So with that in mind, the COVID-19 dedicated care unit opens today. So what is happening today?
So today they had their final orientation. We had the final sort of restocking of our unit on 3A. We've had final discussions regarding with the staff, and certainly the patients will begin to be transferred this afternoon and this evening to the COVID-19 unit. We're quite confident that the staff are prepared, rightly so anxious, but certainly they have all the support of the hospital and the senior team, physicians. It's a whole team that are going to work together to support the individuals, the nurses, the sort of support workers on 3A.
So what sort of measures have we taken to prepare and support staff and professional staff who will be assigned to that unit?
Yes, we've run multiple simulation, sort of scenarios over the weekend. If people suffer any sort of cardiac arrest on that unit, we have protocols for the cardiac arrest. We have people who need to be transferred to diagnostics. They're looking at different techniques, going through the hot and cold zones on patient transfer. Certainly, we've got a dedicated PPE sort of area where you actually would don your PPEs and take it off. We also have special sort of we call scrubs for our employees there, so they can actually change their scrubs when they get to work and take it off before going home to work. Again, all to prevent bringing things back to their loved ones at home. And we're also looking now into providing lodging for staff who feel they require it to protect their families and bringing things back home. And we should have more information on that over the next day or two.
Sounds like there's been a great deal of work going into preparing for the opening of this unit. Is there anything you'd like to say to those who were involved?
The staff on this unit, the staff in our intensive care unit, the staff in our emergency department, the staff in our renal department, where there's a large exposure to potential COVID-19s, we cannot do enough for them, and we're trying to do our best.
How are staff feeling?
Again, the calm before the storm. They certainly are feeling well prepared. I think for the most part, they're feeling well supported. But there's an uneasy anxiousness out there to how many patients we are going to get in this hospital. Again, we can deal with a certain number of patients, 5, 10, 15, 20. Can we deal with 200? Not in a responsible way. So that's why I'm going to get back to the community. We're just one small part. We're the last stage where people is going to come. We need to prevent people from coming to the hospital. So, and the reason we prevent it is prevent the virus not coming to Thunder Bay in big numbers.
Okay. And what is the personal protective equipment or PPE situation at our hospital right now?
We are conserving a number of the PPE protection items we have. If we continue to minimize the influx of patients with COVID-19 at Thunder Regional Hospital, continue to conserve the PPE and only use it in appropriate cases, I think our supply should be okay. We're reassured by the province that we will get more supplies. And in fact, as of this morning, I heard there is going to be an increased supply of our surgical masks coming from the provincial government within the next couple of days. So that will help supplement our surgical masks. So that's the first step of getting items restocked. And I know the province is doing the best they can. So, but we still need to conserve and use appropriately.
Are donations from the community for PPE helping?
Oh, absolutely. I mean, we're certainly accepting all donations. They're being reviewed by our Occupational Health Department to make sure they're up to standards. I can't give the exact numbers, but the community has stepped up, construction has stepped up, dental offices have stepped up. The NOSM group are really trying to canvass some good supplies, and they're going to primary care offices too. So I think everybody's working really at a good pace. We've had people step up using cloth masks, I saw people today in the hospital wearing cloth masks that are non-hospital issued, but still if they feel safe in them, I think we encourage it.
Okay, so just a reminder to the community that if you have a donation of personal protective equipment to make, please contact Tanya at 252-2111. So back to those cloth masks for just a moment. They are coming in this well. People might remember that previously, a few weeks ago, we had ordered a large supply of cloth masks for staff. What should staff expect when these arrive?
Yes, I mean, it's, looking back, we'd ordered these cloth masks from a supplier in town probably 3 or 4 weeks ago, even prior to Dr. Tam, our public health officer, advising it. So again, these cloth masks will be distributed to the staff if they wish to wear it, if they're unable to keep their 2-meter distance apart. And these cloth masks have a specific filter in it. Now, they still only protect a staff member from transporting the virus to somebody else. It still doesn't protect a staff member from getting it, from somebody else in the hospital or in the hallway or in the community. But certainly it has good advantage to protect the individual wearing it from spreading the disease. Again, still important to keep your 2-meter distance and also coughing into your sleeve, but it has some limited advantage for the person spreading it to other community members. And we will be distributing those masks over the next 4 to 5 days to the appropriate staff. And I think it shows another area of support that we're trying to support our staff here at Thunder Bay Regional Hospital.
Okay, so those cloth masks are not for direct patient care then, they're for people who might be in patient care areas? Is that?
That's correct. It's not for, they must take off those masks when they're going to give direct patient care, actually, and they can be washed and cleaned at home.
Great. Okay, well, thank you for the updates. Please join us again tomorrow.
Thank you.